My name is Chantal Thornton and I'm a specialist breast cancer surgeon. What drew you into cancer treatment? I trained as a general surgeon and then I subspecialised in breast cancer and melanoma, and now I just treat ladies with breast cancer. And I mainly selected this because I have a very strong family history of breast cancer. Growing up, I was aware that there were many female relatives in my family with breast cancer, and I saw a favourite aunt die at a young age of breast cancer who lived in a rural community, and I wanted to make a difference to the lives of women that are dealing with breast cancer. When people find out what you do, what's the most common question you are asked? Mainly they ask who is going to do the surgery, because I still think that people are not expecting females to be surgeons. And so they say, oh, do you actually operate? And the answer is obviously yes. So it's mainly about the technical side of my specialty. What's changed in the treatment and survival rates in the last 20 years? Well, fortunately for me, breast cancer is a cancer with great survival rates. And so now for all comers, the survival rates are in the order of about 92%, which makes my job extremely rewarding. It also means that when patients sit down and we tell them they've got a diagnosis of cancer, it's not a death sentence for people. And even though it is a difficult word to include in a consultation, women can feel very positive. I would be hoping that in the future we would be able to treat breast cancer with medication alone, and that surgery may only be needed as a last resort. Is there one thing about your specialty that you think people would be surprised to hear? I think that people would be surprised to know that most people that present with breast lumps or breast symptoms do not have breast cancer. And so as a specialist breast cancer surgeon, we spend a lot of time consulting on patients that actually will never go on to have breast cancer and might have a problem in their breast like benign breast disease and don't actually have breast cancer. Many patients that I see have consulted Dr. Google or consulted a friend, and the information that they receive is totally irrelevant. Most people with breast cancer will live a very long time, and so it's important to only look at websites that your doctor specifically instructs you to, and that you understand that your experience and your cancer is totally different from your friends or your relatives' experience and cancer. What are the things that people should avoid to lower their risk? Increase your exercise capacity, increase your fresh fruit and vegetable intake, reduce your alcohol intake. They should avoid having a sedentary lifestyle, so we recommend 250 minutes of exercise a week. Some of the risk factors you can't change, like your genetics, your family history. We think it's very important for women and all women of all ages to be breast aware. It is important for ladies to know how to examine their breasts, but more importantly, it's to know what your normal breasts feel like. For women that are menstruating, we know that their breasts change throughout the menstrual cycle, and so there are different times of the cycle where the breasts will feel lumpier, and that's normal for that patient or that person. And so I think it's important for all women to get to know what the normal size, shape, texture of their breasts are throughout the cycle, and to be able to be breast aware. That will help them be able to track whether or not there are any changes in the breast. When we talk about a breast lump, most breast cancers, in fact, do not present as a breast lump. So 70% of all breast cancers are asymptomatic, and that's because of breast screen. But of those that are symptomatic, they may not be a lump. They may be a thickening, a tethering of the skin, a rash of the skin, a change in the contour, size or shape of the breast. And so it's very important that women know what their normal breasts feel and look like. What's the one piece of advice you would give someone who has cancer? I would say to them, never give up hope, and that we know our immune system is very intimately related to the way our body fights cancer. And so staying positive, maintaining great mental health, surrounding yourself with vibrant, positive people will help improve their survival. What's the most important thing that you want anyone watching this to know? There are many things that I want people to know. Firstly, however, that breast cancer is not a death sentence, and most women that are diagnosed with breast cancer will live very long and fruitful lives. Secondly, that if you've got a breast lump, make sure it's investigated, even if the imaging is totally normal. Thirdly, if you're over the age of 40, go for regular breast screening. And certainly if you're over the age of 50, enroll in breast screen.